So a few days ago, I had a very interesting conversation with some colleagues who are in the healthcare and social care sectors. So they are running private companies where they're taking contracts from the NHS and local authorities and from private clients. And we're talking about induction, just discussing what they're doing for induction. And there were particular issues raised around safe handling and administration of medicines. And I was saying to them, guys, look, maybe you're looking at it the wrong way, right? You're telling me that a lot of your care workers, some of them who are completely new to the sector or have not got much experience at all, they're getting an online course for medicines management, maybe 1 hour, 2 hours. Yes, of course, you've got your policies and procedures and supervision and other things. But let me flip it the other way. When you look at a nurse in the UK, they're spending 3 years in university doing a degree. During that time, they're doing the academic work, they're learning about anatomy and physiology, pharmacology, drug calculations, health policy, all sorts of modules that they're doing. But they're also going to placement. Every few months, they go to a placement where they're actually working in a hospital or in a community setting, and they're working with experienced nurses and other people, multidisciplinary teams where they're being signed off for certain competencies. Then after they finish their degree, then work under supervision for anything from 3 to 6 months, where they have to be signed off for post-qualification competencies. And only then can they start now independently writing care plans and giving medicines without getting somebody to countersign for them. And you're saying to me that it takes about 3.5 years for a typical nurse to then start working independently after going through all this training. And for a care worker who has not gone through any meaningful clinical training or education, they do a 1 hour, 2 hour course and maybe they read your policy and they're fine to go out there. So it draws a lot of issues here. It draws a lot of issues around safety. If you think about CQC and other regulatory bodies, safety is right at the top of their priorities. If people don't have the confidence to go out there and do the job properly, what does it do as well to the morale of the team? What about drug errors? What about the legal position? Actually, does the insurance cover you adequately? And also the service user, most importantly, to sort of say, look, they are paying, some of them are paying for this service, or the government is paying for them, whichever the case, right? They deserve to get properly trained people looking after them. So what am I saying here? I'm not saying that we as a business have all the solutions, but I like having these sort of conversations to sort of say, look, how can we improve how people are trained in the care sector, particularly? It's not only the induction or statutory and mandatory training, but it's the ongoing training. If it's taken 3.5 years to get a nurse to start working independently, why do we think it should take a week to get care workers trained? They do the mandatory training, everything they do it so quickly, they don't even have time to take it in. They do it so quickly, and they're ready to go to work. So I'm not having a dig at care companies. I know there are a lot of good care companies out there that have fantastic systems, and even when we work with them, you can tell actually when you come in, sit down to do a needs analysis, so look at what they already have in place. You can tell that some companies are much better managed. They have better systems. They're investing in compliance and training. The workforce development side of things, to say, it's not just a matter of getting people to work quickly, but actually getting them ready. Taking time to actually make sure that they're trained properly, they're supervised properly, they're given the support that they need. So I've got my own thoughts, and if you follow my blogs, you know that I write about these sort of things, and I've got my recommendations as well. But what I would like to hear is your thoughts as well. What are your thoughts? What are you doing differently? What practices actually can others follow to make sure that it's safe for everyone out there? Because who knows, the next time I'm in a hospital or any care facility, I would like to think that everyone who's there has been trained properly. They can look after my needs and make sure that I get the care that I've come in for. So in the comment section below, if you don't mind dropping your thoughts and let me know what you think, then we can have a conversation. See you soon.